Differences between maxillary and mandibular incisors. In our previous videos, we have learned the anatomy of the maxillary and mandibular central and lateral incisors, and also thoroughly explored the differences between the central and lateral incisors within each dental arch. However, we have yet to explore the differences specifically between the maxillary and mandibular incisors themselves. So get ready to discover the unique features that make these dental gems stand apart. The differences will be discussed under absolute and comparative differences as previously covered. The initial and most conspicuous difference lies in their size. Maxillary incisors are notably larger compared to their mandibular counterparts. The feature that defines the maxillary central incisor is the crown width. It is wider and roughly two-thirds the dimension of the cervico-incisal length. In the mandibular central incisor, however, the crown is very narrow, about half the length of the crown. Now let's begin our examination by inspecting both sets of teeth from the labial aspect. First, let's focus on the outlines to note their comparative differences. In mandibular incisors, the mesial and distal outlines appear relatively straight, with their contact areas situated near the incisal edge. Conversely, in maxillary incisors, these outlines take on a more convex shape, with contact areas positioned at different levels along the tooth surface. Now, turning our attention to the incisal angles, we notice another comparative difference. Maxillary incisors exhibit relatively rounded incisal angles, while mandibular incisors, in contrast, feature sharper, more pronounced incisal angles. Next, examining the teeth from the lingual aspect, we observe significant absolute differences in the prominence of key anatomical landmarks. Maxillary incisors tend to showcase more distinct features like a well defined cingulum, noticeable marginal ridges, and a lingual fossa that often reveals the presence of a bit and occasionally developmental grooves. Conversely, in mandibular incisors, these characteristics appear inconspicuous or less prominent, with the lingual fossa presenting a relatively smoother surface. Now, shifting our focus to the proximal aspects of these teeth, here we note the most prominent absolute difference. Let's visualize drawing a line right through the center of both the crown and the root of these teeth. What becomes evident is that in maxillary incisors, this line would precisely bisect the apex of the root as well as the incisal ridge, indicating that the incisal edges align with the root axis plane. On the contrary, with mandibular incisors, the incisal edge is positioned lingual to the midline, primarily due to the labial surface's inclination towards the lingual side. Let's now consider the incisal aspect of these teeth. The mandibular incisors exhibit a wider crown due to their labiolingual dimension being greater than their mesiodistal dimension. Conversely, in the case of maxillary incisors, the crown appears narrower because they are wider mesiodistally than labiolingually. When examining the incisal ridges, other absolute differences for mandibular incisors can be noted. The mandibular lateral incisor distinguishes itself with a distolingual inclination, while the mandibular central incisor stands out for its bilateral symmetry. Next, let's turn our attention to the roots of these teeth. The absolute differences are that the roots of maxillary incisors are notably larger compared to those of mandibular incisors. Second, much like the crown, the roots of maxillary incisors exhibit a wider mesiodistal dimension, whereas in mandibular incisors, the width is emphasized labiolingually. The comparative difference is the presence of deep developmental depressions, particularly accentuated on the distal side of mandibular incisors. In contrast, these depressions are less pronounced in maxillary incisors. Moving on, when we compare the central and lateral incisors in both arches, we encounter significant distinctions in the case of maxillary central and lateral incisors. They not only differ greatly in terms of size, but also exhibit distinct variations in morphology. In contrast, mandibular central and lateral incisors share similar morphology. When it comes to size, an interesting absolute difference can be noted between the maxillary and mandibular incisors. In the maxillary arch, the central incisor is notably larger than the lateral incisor. However, in the mandibular arch, this pattern is reversed. Here, the mandibular central incisor, being the smallest tooth in the dental arch, makes way for the mandibular lateral incisor, rendering it larger than the central incisor. Finally, let's also delve into the chronological differences in the eruption of these teeth. The mandibular central incisor takes the lead by erupting first, typically between the ages of 6 and 7 years. Following closely, both the mandibular lateral incisor and the maxillary central incisor make their appearance nearly simultaneously, generally emerging between the ages of 7 and 8 years. Lastly, the maxillary lateral incisor completes the sequence, typically erupting around 8 to 9 years of age. I hope that now you have an in depth understanding of the anatomy of all the incisors. Now, as we wrap up this video, let us take a close look at this image. Do you notice something interesting or unusual about the incisors? Do these incisors remind you of the blade of a screwdriver? These unique incisors are notched at the end, forming a crescent shaped deformity. They exhibit a distinctive width that's broader cervically and narrows toward the incisal edge. Therefore, they are often referred to as screwdriver shaped incisors. In this condition, the middle lobe of the labial aspect is deficient, leading to a notched incisor, where the two proximal lobes converge. This dental anomaly was first discovered by Hutchinson, leading to the alternate name Hutchinson's incisors. Importantly, this feature is characteristic of congenital syphilis. And that's a wrap. Hope you had fun learning with us. Don't forget to like the video and subscribe to our channel.